Hi, I'm Richard Seglenieks, a Provisional Fellow at Western Health in Melbourne. In collaboration with Trash, I undertook an audit of perioperative paracetamol use, primarily to help inform whether we should be giving oral paracetamol to more patients preoperatively. Paracetamol is inexpensive, safe, and effective, so it should form part of our multimodal analgesic regimen for patients undergoing painful procedures. Compared to its IV form, oral paracetamol has equivalent efficacy while being cheaper, producing less waste, and avoiding the rare but serious risk of venous air embolism. A retrospective electronic chart review was performed at St. Vincent's Hospital, Melbourne, Australia, to determine the proportion of patients receiving paracetamol perioperatively and the routes of administration. All elective non-cardiac surgical cases in the main operating theatres in 1 week in December 2020 were included. The site does not perform obstetric or paediatric surgery. Data were collected for 147 patients, of whom 48% received at least 1 dose of paracetamol in the immediate perioperative period. 90% of these doses were IV and 10% oral. Less than 3% of patients received preoperative paracetamol, and only 1 was specifically prescribed a preoperative dose, with the remainder being regular doses for inpatients. 18% received paracetamol intraoperatively, and 47% postoperatively in the recovery room. In our institution, paracetamol costs 1.5 cents for 2 500mg tablets, and 80 cents for a 1-gram vial for IV administration. The IV formulation is thus just over 50 times more expensive. While the relative cost differential is large, the absolute difference is small, and if all IV doses were given orally in this audit, then this would represent a total saving of $51 over a 5-day period for elective surgical cases only. Proposed actions based on this audit are to educate anaesthetists and nurses about the benefits of oral paracetamol administration, to develop processes to facilitate preoperative paracetamol administration, which could include nurse prescription, a standing order, or advising patients to take paracetamol prior to arriving at hospital, and also encouraging paracetamol to be given orally instead of IV in the recovery room when safe to do so. I hope some of you will also be able to introduce these actions into your own centres. Thank you.